Good Friday morning. We are in the later part of August. Congress is still on vacation, but we are not. So let's talk about what's happening. I'm going to spend probably most of the time today talking about various things the federal administration is doing, but there's still a lot of movement in Congress, even though they are on vacation. So I will begin by doing a little follow-up from something we talked about last week. Last week, we talked about a new, since July, change in policy where the Centers for Medicaid and Medicaid Services apparently agreed to share state Medicaid data with other federal agencies, including the Department of Homeland Security, without telling states that they were doing that and without really states having an understanding of what information was being shared. States are legally required under federal law to provide information to CMS. And CMS has typically, at least in the past up to now, kept that information confidential. However, we have seen a pattern in this administration with wanting to consolidate and share information from various agencies that have been siloed, that their information sets that they have for different purposes have remained separate. This administration has wanted to marry those sets of information together. So first of all, it's important to know people believe that one of the reasons why CMS is sharing Medicaid information with the Department of Homeland Security is to facilitate immigration enforcement. In other words, looking for undocumented people or perhaps people who are here legally, who may have had a status that's changed with the purpose of locating those folks for deportation. So that is an assumption that is being made. It's important to remember that immigrants who are not in the U.S. legally, undocumented immigrants, as well as some lawfully present immigrants, aren't allowed to be enrolled in Medicaid. So there aren't a lot of undocumented people in the Medicaid rolls because unless there's a state has made a mistake in verifying their immigration status, which is part of the eligibility check process. And in Wisconsin, we're really good about making sure everybody who's in Medicaid is supposed to be there. However, federal law does require all states to offer emergency Medicaid services to anyone who needs them without regard to whether or not they are a citizen or here legally. And so there may be some records of people who have received emergency services. And there are certainly families where there may be mixed status members, where you have some members of the family who are citizens or here legally and others who are not. So it is not inconceivable that you may have some people who have an immigration status that is, not citizen and not or undocumented or whatnot that are in these records because they've accessed emergency services or they have been affiliated with somebody who has. And Wisconsin with 20 other states, joined a lawsuit challenging this policy, in part because many of the healthcare providers looked at this idea of having to document, figure out whether somebody is, a citizen, to be really burdensome, especially in the delivery of healthcare services that are time sensitive. So Wisconsin was part of a lawsuit that said, hey, wait a minute, we don't think this new policy of CMS sharing personal data of Medicaid enrollees with deportation officials is a good idea for privacy and other reasons. There was a ruling this week that temporarily stopped CMS from sharing that data of Medicaid enrollees in the 20 states that filed the lawsuit. So people in Wisconsin who are using Medicaid, there is now a temporary order that CMS is not allowed to share your data. That order is temporary because it is unclear whether CMS actually can is not prohibited under law from sharing the data. It appears they may have not gone through the right process. So we should look at this as a temporary pause as opposed to a definitive ruling you cannot do this. And of course, states don't have any knowledge about the data that's already been shared, who has access to it, whether copies were made, were saved, or any of those things. So it's a continuing pattern that we have seen where once somebody has access to those data sets, it becomes very hard to control where that data goes and how it's used. We've had a couple of people have success in getting letters to the editor published. So just a couple of things so that you can see your fellow advocates across the state are getting in the presses, they're getting in print. One very focused on disability and another very focused on somebody's experience not only with SNAP, but with the Affordable Care Act. So two nice pieces. This week we came up with another model, more focused on SNAP this time. We're going to talk about the implementation of the reconciliation bill that was signed into law on July 4th. You know, I think there's been kind of a message of, oh, well, those things won't go into effect for some time, which we've talked about. Well, that's not actually true because there's a lot of work that needs to happen. And in previous webinars, we've also talked about how the changes to the Affordable Care Act will actually hit people pretty soon. That is also true of the SNAP work requirements. So we are trying to help people understand that the changes specifically to the prove you're working or exempt requirements are probably coming sooner than you think, as early as this fall. Actually, the prove you're working exempt requirements in Medicaid, we've had new information that says, yeah, those are going to be implemented sooner than what the people originally thought as well. So again, you don't have to use any of this language, but if it's useful to you and you want to write a letter, you've got a script that you can work with. We're still doing our survey. We are now 33% of the way to our goal. So if you have not shared this survey yet, please do. If you have not taken it, please take it. And even if you've shared it before, people sometimes need reminders. Remember, it takes about 6 to 7 repeats before somebody actually takes the action. So if you feel like you've been a broken record, maybe that's true, but it might be the first time that somebody is hearing you say it. Trust me, as a mom, I repeat myself a lot, and I'm just never quite sure when it actually sinks in. So let's talk about Congress. I've retooled this timeline a little bit, and you can see this isn't a big span of time. We are in the August congressional recess, but we're actually kind of moving towards the end of it. And there's an awful lot of stuff that is going to get packed in between September and January 1st that could be pretty important. So Congress isn't going to be back to do any of its work until 2 weeks from now, early September. And that means they have very little time before the end of the federal fiscal year, which is September 30th. If they don't have either a 2026 federal budget passed or a continuing resolution that says we're going to keep, we're going to continue to fund these things while we work out the details, the government shuts down. So they've left themselves relatively few working days to do a lot of work. some of which is kind of half done. And the House and the Senate also have to agree on the same language. So a lot of things to get done. Most watchers are not thinking that they will get the full 2026 budget passed by the deadline. And Congress is talking about, well, what are ways that we get something done if we're not going to get it all done. October 1st is the first day of the 2026 federal fiscal year. That's important because that becomes the first day when Congress can actually do a second reconciliation bill. You could do one reconciliation bill per fiscal year. So this would be their second opportunity to do that this term. We are also going to start seeing some of the implementation of the first reconciliation bill hitting this fall. Likely SNAP work requirements in states will have to be coming online, as well as people with Affordable Care Act marketplace plans will start to see what their rates for next year are going to be if the subsidies aren't extended. There's opportunities for Congress to use either the federal budget process or standalone legislation or even a reconciliation bill to do a lot more things. Things like they could extend those ACA subsidies. They could change and roll back some of the changes they made in the first reconciliation bill. They could double down and make additional cuts to some of the same programs or different ones. In all of those mechanisms. So there's a lot to watch there. The other thing that we will talk about today that we haven't before, and again, it's another consequence of the first reconciliation bill, is the idea of sequestration. Because the bill that passed in July 4th really significantly added to the deficit. There's been reporting before about, well, if Congress doesn't do something, that will trigger automatic spending cuts in a number of programs. And most of the coverage has been about Medicare. Medicare is not exempted from those automatic cuts. So in the spring, and now again, folks pointing out that if Congress doesn't do anything and sequestration is allowed to happen, that's a 4% cut to Medicare, which translates to about $491 billion. But Medicare isn't the only thing that would be subjected to those cuts. So in addition to the federal 2026 budget, a possible redistricting, rescissions requests potentially, and how do we avoid sequestration, you can see that there are a lot of crisis points that are lining up on this timeline that could mean leverage for either more cuts to happen or for Congress to change course. So first, let's start with the 2026 budget process. Earmarks is a word I haven't said before. Some of you may remember a long time ago, we had a Wisconsin congressional rep named David Obey, and he was always a big fan of earmarks because it was a way for individual congressmen to be able to bring back federal dollars for specific projects in their district. And he always thought it was a useful system of horse trading so that everybody could kind of have their list of projects that could use a funding boost and use that as horse trading, right? If you've ever heard of the phrase bridge to nowhere or pork barrel spending, that is a reference to earmarks. In other words, federal money that goes to a very specific place for a very specific thing that doesn't necessarily benefit the whole country, but it does benefit an individual district quite a lot. And Representative Obey would say that in the past, earmarks have been used as leverage. Like a member would say, well, I'm not voting for this unless you give me these things. And in this case, Congress is relooking at starting an earmarks process as a way to actually control spending as opposed to increase spending. A lot of times earmarks have been criticized as having as increasing the amount of money the federal government is spending without a lot of accountability, because all of these separate projects are not part of an actual federal program. They're kind of add-ons, earmarks. But in this case, Congress is seeing that they are going to have a hard time passing a federal 2026 budget, especially because there are lots of members of Congress who don't want to spend any more dollars. And yet there are many federal programs that are saying they need additional money to keep up with the cost of doing business. So there are a number of House conservatives that now see earmarks as a strategy to get to a flat funding continuing resolution. In other words, fund the things that we're doing now at the same level, which doesn't always mean everything that's being funded now continues to get funded. But that's the idea of a continuing resolution, is we pass something that's temporary to keep the government doors open and money flowing for things that the government does while we're working out a bigger deal. And they're looking at earmarks as being a way to maybe drive some money to certain members' districts while also not increasing funding for the programs that may have a larger or more national impact across states. And if you are doing a continuing resolution that really doesn't raise spending at all, that does mean there are hard decisions, especially if you're adding spending with earmarks. So again, when you're thinking about leverage, if you want to spend more money on earmarks, does that mean you spend less money or cut programs that are part of kind of your normal cost, your normal business? Maybe. It also means that programs that need more money because the cost of doing business has increased don't get any more money, which ostensibly works out to a funding cut without reducing the dollar amount, because it costs you more to do the same things. So interesting development, and something we haven't probably seen in 25 years. There was a real movement to end the earmark process, and it has not been done in a while for those reasons. But in this case, I think the strategy is really about rewarding certain members for voting for a flat funded CR, as opposed to members actively approaching their colleagues with a number of local projects and getting that money plus all of the funding for our normal federal programs. So we, as usual, we have included some questions that you can ask your members of Congress, and you will get these questions pulled out in the after message. And this one is really about, how do you make sure that those earmarks will not take away funding from the programs that benefit people in every state? Moving on to pocket rescissions, we've talked a lot about this in the last probably 6 to 8 weeks. And it's kind of been an behind the scenes and undercurrent. It's been a consistent part of the conversation where the Office of Management and Budget Director does keep saying he intends to have additional rescissions packages or deferral requests to make to Congress. It seems like this week lawmakers are sensing that rescissions requests will come in September. And again, think about that timeline. They're coming back September 2nd, and they've got until September 30th before the end of the fiscal year. So if you're asking to not spend 2025 money that's never been sent out 28 days before the end of the fiscal year, this is a strategy to essentially say we're not going to spend the money that Congress appropriated. The rumor, and it is just a rumor, is that some money that has been appropriated to the Department of Education might be a likely target for a second rescissions request. There's certainly been a proposal to eliminate the Department of Education as an agency that has been kind of moving along. So it would fit with that. And of course, a lot of members of Congress who are trying to think about the 2026 budget continue to be very concerned that their promise to fund certain things might not be honored by the administration if the administration just holds the money and runs out the clock, and or there's another rescissions request sometime after they've passed a budget that asks Congress to not spend money that they intended to spend. Before we get too concerned about Congress's feelings, we should remember that they've had now 11 months to understand what money the Trump administration has not released. And I was at a meeting earlier this week where an advocate was describing a small program that I think is in the Department of Labor that helps older adults over age 55 connect with the workforce that has never received its 2025 allocation. That is not the only example of programs that exist and have been funded that Congress appropriated money who have never gotten those funds. So, the fact that Congress is not actively saying, hey, what are all the accounts where the money hasn't flowed? And why is that? And has not been asking questions of the administration to make sure that the amount of funding they've appropriated actually gets to the place it needs to go. That is really Congress being complicit. And it does concern members about, if we agree to spend money on certain things in 2026, and we've had a whole year where our agreement hasn't been honored and we haven't questioned it. Well, what does that mean for this whole process? We're deciding what to spend money on if it never gets where it needs to go. So here's a question about that, if you are so inclined. And I do think that it's very hard for any one person to know. There's been so many specific programs where the money has been delayed or impounded or frozen, that there's not one place to know the full scope of it, but it is happening across lots of federal programs. So I'm calling the July 4th reconciliation bill the first reconciliation bill. It's the one that just passed, right? The 2025 reconciliation bill. And this isn't necessarily new news that that bill may have a big impact on Medicare, even though the actual text of the bill does not make cuts to Medicare. There is an existing law, sometimes referred to PAYGO as pay as you go. That's PAYGO. There's an existing law that says, hey, Congress, if we pass a bill that increases the federal deficit by too much, then that means we're going to make sure there are automatic spending cuts to other federal programs, because we're trying to control the level of spending. So if you've had a bill that decreases revenue too much or increases costs too much, or both, then that'll have consequences for all sorts of other programs that you didn't make a decision about whether or not to fund more or less. So despite Congress coming home and trying to say that their July 4th reconciliation bill doesn't increase the deficit at all, that is not the opinion of the Congressional Budget Office, who does see that continuing to not take in revenue from tax cuts means that you are in fact creating a hole. If those things had expired, then you would have had more revenue. So the formal accounting practice that has always been used by the Congressional Budget Office estimates that $3.4 trillion of dollars will be added to the federal debt because of the July 4th reconciliation bill. And that's enough. I mean, it's a big amount of debt. So that's enough to trigger the PAYGO law. Specifically, Medicare would have an automatic cut of 4%, which works out to be $491 billion. There are some programs, Social Security and Medicaid, that are exempt from the PAYGO law. That means they won't receive automatic cuts. But there are lots of things besides Medicare that would also be subject to automatic cuts. And there's a fancy word for those automatic cuts. It's called sequestration. So if you hear that word, that's what it's talking about, the implementation of those laws. And there is, again, a time frame by which Congress has to act to avoid those automatic cuts. And it works out to be the end of this session, which is December 18th. At the end of every calendar year, the Office of Management and Budget has to do some work to, make some calculations about, deficits and, what programs would be subject to the PAYGO rule and then how much they would be cut by. So the end of the congressional session is December 18th. Obviously, the end of the year is December 31st. And that gives you a time frame of, if you don't say we're not going to do we're going to absolve these programs from PAYGO law, then those things have to happen. And that would mean that 2 weeks into next January, the Office of Management and Budget would be in the position to issue a sequestration order, which essentially would automatically remove funds from all sorts of what are called federal discretionary programs. Now, the Congressional Budget Office put out a memo that estimates, here's the programs impacted by sequestration. You'll get a link in the afternotes. And one of the things it says in there is that the amount of money that OMB has available to cancel isn't enough to recover the required cuts of under sequestration. In the past, Congress has always acted to not do this. So it's a law in the books that has really never gone into effect. There have been a couple of times we've come close, but this is something that has to happen, and it will need bipartisan cooperation to do so. So again, thinking about crisis points that become leverage points, this is now another thing at the end of the year that could really impact a lot of federal funding. So even if you think you're safe, let's say you've got your federal 2026 funding and you don't think that you're going to be subject to a freeze or a later rescissions quest, and you're not in the reconciliation bill, well, this could happen at the end of the year, and you might be not receiving the amount of money you think. So it's a good question to ask Congress to make sure they understand they have to do something if in fact they do want to fund things and be able to have that money come back to their district and be used. They have to be kind of diligent about every phase of this funding process to make sure that cuts don't happen either in the federal budget or in a rescissions request or in a reconciliation bill or in a sequestration that is triggered by the first reconciliation bill they passed. And there continue to be discussions about what to include in a second reconciliation bill, a reconciliation bill that could happen as part of the 2026 year. So last week, Republican House members heard from an organization that recommended more Medicaid cuts and this time Medicare cuts. There were a couple of briefings this week, and you can kind of see that a variety of issues were covered. I think the pattern I would draw your attention to is that many of the issues that we see on the screen here, or that have been briefed to Congress who's thinking about another bill, are issues that were included in the first reconciliation bill. So, for example, immigration and Medicaid and Medicare, all of those things were part of the discussion in the first reconciliation bill, and they seem to be discussing the same issues as opposed to, doing different things in another big package. Okay, we're going to move on to some of the activity that the federal administration, the Trump administration, has been doing. And we're going to start in a place that we haven't talked about much before. There have been a couple, and I included the actual posts by the president that he posted on Truth Social here. There is a couple of indications that the president is interested in issuing another executive order on voting, and this time with specifics on banning mail-in voting and voting machines. Now, this has been, if you followed voting law in Wisconsin and across the country, Wisconsin's Disability Vote Coalition has been very active on many pieces of state legislation really over the last decade. And that has been true in other states as well, that have tried to change voting laws in ways that we think would reduce access, especially for people with disabilities and older adults, especially for people who are non-drivers. So you may remember that there has been a lot and in many states, not just Wisconsin, a lot of activity that has been focused on absentee ballots and ballot drop boxes and changing processes, maybe making it a shorter window of time to apply for a ballot, changes to when you can register and how easy it is, polling place hours, just lots of different ways that states have, adjusted their voting laws, and in some ways made them more restrictive, or in some cases made them broader so that more people can access. There's a lot of commentary about these two posts, and this is the first one, because mail-in voting is used by many, many people in the country, about a third of all voters in the United States. And there are several states that have shifted to mail-in voting as the main way that people vote. I believe Washington and Oregon, there's like 4 or 5 states, also includes Arizona and Florida. And some of the states where Colorado, where mail-in voting is, the primary way people vote, tend to vote Democratic. And there are a couple of states where those states tend to vote Republican. So one message is all sorts of voters, regardless of party, use this mechanism of voting. But another message is more people, there's an assumption that more people from one party use this method than others. Voting machines are also another item that it appears in these posts, and they're kind of used all over. So it is unclear what kind of restrictions there might, or ideas there might be about voting machines. You may remember over the last 10 or 15 years, there's been a lot of repeat comments about that are intended to trying to call into question either the accuracy of mail-in ballots or the accuracy of voting machines in terms of counting how many people voted for what candidate. And this appears in this post as well. So here's the second post that came out a couple of days later. The other reason why people are really focused on this language is that we also, and we talked about this last week, we are also in a time period where there have been a number of Republican states, Texas among them, that have been approached by the president to say, hey, I think you should change your district maps early to make sure that more Republican members of Congress get elected, especially in the House. And that has been a very clear, transparent, there has been a request to states to change their maps for the purpose of having outcomes of certain party winning more seats in the House. That is the intent, and it's been very clearly stated. So advocates worry that that mechanism, plus calling into question or trying to figure out how to change voting laws, might be part of a strategy to either steer the outcome of the 2026 midterm elections or challenge the outcome of certain elections if there are results that perhaps they don't like. So this isn't the first time either that the president has issued an executive order about elections. On March 25th, he put out an executive order that asked to make many changes to elections. Among them, require documentation for people to prove citizenship before they could register to vote. Now, courts blocked the executive order. However, Congress introduced a bill to make the changes contained in the executive order. It hasn't passed yet, but that's going to be important later for a minute. Big thing, no executive order has been issued yet, and an executive order cannot change federal or state's voting laws. Elections are at this point run by states, and states allow smaller jurisdictions, counties, cities, even townships, to run their own elections. So every state has their own voting laws. Every state is managing their own elections. It is very decentralized. There is really not a federal role in running elections that are occurring in states. However, executive orders, just like when the president put out his federal 2026 budget, they are a statement of intent. They provide a policy direction, and they sometimes give a green light to say, these are the things that I would support should you choose to do them, right? An executive order does mean that federal agencies can make changes to their policies to align them with the intent of the order. Now, there's not a big federal role in elections, so it's unclear what they would do to align with an order that would come out. But it's also a really important signal, not only to Congress, but to state legislators about here are the kinds of policies that I think would be good ideas should you choose to do them. And in that way, an executive order can be a permission structure to make changes to laws or policies in ways that further the goals of the executive order. And we've had and seen many state legislatures, including Wisconsin's, contemplate many changes to election laws some of which disability and aging advocates have opposed because we do not think it would help more people vote, and we actively think it may not help certain populations of people to vote. In other words, it would really limit their ability to cast the ballot and exercise their civil rights to vote. So why are people worried about an executive order that hasn't happened yet? The first one is exactly my last point. You could encourage states to change their voting laws or restrict voting methods or equipment, kind of in anticipation or thinking about that order. Now, certainly we're in the context where the president has asked certain states to redistrict for the purpose of determining, what party will control a seat. So I don't think it's without the realm of possibility that a state that has been willing to think about redistricting might also think about, well, how could we change our voting laws to kind of match what the president is saying? And it could encourage states to make changes that would make it more difficult for voters to vote by mail. This is where it is also important to remember that in the states that vote almost exclusively by mail already, Wisconsin is not one, but there's a number of states that do vote by mail as their primary method of voting. That means if you restrict or make it harder to do mail-in voting, they don't have voting machines or trained poll workers or polling places or other infrastructure that would be, they could easily transition to, say, in-person voting. There's a lot of stuff you need to run an election, including trained people who know what the state's laws are, and equipment and other things. So it is kind of a beautiful ballet that happens mostly seamlessly, but any change in process also means people need to understand that change, and you have to have a system that makes it run smoothly. And states that have been doing mostly mail-in voting, they don't necessarily have all of the things that you need if you're going to switch how you do your voting to in-person. And the reality is, and this has been shown over time, that if it's hard, if you make something harder to do, that generally means more people will not be able to do the thing. We've talked about that in terms of prove your working requirements. Every time there's more process or more things that have to be done correctly, and certainly that's been part of what the Disability Vote Coalition has commented on in some of the bills that have been in front of Wisconsin state legislature, is that when you make the consequence of a mistake so that somebody's vote doesn't count, and make it easier to make mistakes, it becomes more true that there are less people who can successfully vote. The other kind of things that people are really worried about is, there's been kind of a reoccurring narrative over really the last 5 years since the 2020 elections that has cast doubt on the validity of the results of those elections through a number of ways. So when you have somebody who is saying a specific kind of voting that many people use is, fraught with mistakes or fraud, it doesn't have to be true for people to start to believe or question that it could be true. So if there is a concern, more and more concerns that voting equipment or mail-in ballots are somehow not accurate results, it becomes easier to question the results of that election as being true, and easier to have people support challenging the outcomes of those elections. The other piece that some folks are pointing out in the first post, the president really planted a new idea that he alone has control over all elections. And that is, in fact, not how our structure has worked in the past at all. States have local control and home rule where they determine they have some self-determination over how they do things and their own, activities within their borders. But it does seem like a lot of folks are pointing to that piece of, hey, wait a minute, he's kind of asserting that he doesn't think that that's necessarily true. And some folks are worried that that idea helps further a message that there should be more of a federal role or control over all elections, including local and state elections. So voting by mail specifically helps people with disabilities and older adults, a lot of whom are non-drivers, exercise their right to vote. That's why we've been more focused on it in these advocacy circles. And really up until the last 10 or 15 years, most of the work on voting law had been to try and expand access to give more people the right to vote and more people more ways to be able to cast their ballot. That's been shifting over the last 10 years, and the current messaging that we're seeing really seems like the intent is to keep shifting voting laws so that they are more restrictive as opposed to more expansive. Specifically, there was an article on the president's post on mail-in voting. And it's worth noting that while it does impact people with disabilities and older adults a lot more than other groups, it's also a benefit for many, many people who may have a harder time getting to the polls in person within a specific time range on a specific day. Anybody who is a family caregiver knows that sometimes the day that you have planned does not become the day that you have. So folks who need to have time off work or live in areas that are far away from polling areas, or maybe can't afford to wait in line for a long time, or caregivers who can't find, or there's an emergency where they can't make it to the polls on those days. These are also all people who benefit from mail-in voting, because that is something you can control and plan and do in advance, and you are not subject to the weather or the traffic or the length of line or whatever other small things can become big crises on the day of. Moving towards redistricting, I mentioned before that the president had asked certain states to redraw their maps early, with the expectation that those redrawn maps would result in more Republican U.S. House seats. Texas is the first state that has done that. On Wednesday, the House of Texas State House, passed those redistricting maps exactly as requested, and it looks like those maps would in fact help the Republican Party win at least 5 more seats in the 2026 elections. It's expected that the Senate and the governor the Texas Senate will pass the same maps and the governor will sign it. I haven't seen an article that has happened yet, but it was supposed to happen on Thursday. There are now many other states besides Texas who are thinking about whether they should redraw their own maps. And the Trump allies are asking other states that trend to vote Republican, and you can see a few mentioned here, Indiana specifically, Missouri and Florida, to redraw their maps with the purpose of again, creating more seats that will be reliably elect Republicans. Democrats in different states are also looking at now doing the same thing to kind of counter what Republican states are doing. It is a little more complicated in some of the Democratic states because they have different processes. So in California and I believe New York, the legislature can't just decide to draw maps. There may need to be other steps, like going to voters in California, or an independent commission has to agree. So it isn't necessarily as guaranteed that those maps will change, but you can see the idea here is that, you know, Republicans are redrawing their maps, and so now Democrats are redrawing their maps. And the outcome of these two sides redrawing their maps could determine who controls the US House after the 2026 midterms. There's a relatively small majority in the US House right now. I think it's 7 seats, and there's a small majority in the Senate. But if you're the majority party, you really do get to set the agenda. You get to decide who gets on the committees. All of the committee chairs are people from the majority party. You get to decide which bills go through the committees and get a hearing and go to the floor. The majority has a lot of ability to kind of set the agenda and what happens. And you can see when you have a majority in the House and the Senate from the same party, you can move pretty big pieces of legislation, even if they include controversial items in them, if all of your members from that majority party commit to voting for those things. So this is a strategy to continue that scenario and in fact make it even more solidly a majority, to be able to, and if that happens, then you know, you can successfully move pieces of legislation with only votes from one party. In a previous webinar, we talked about why are we talking about this at all? Conventional wisdom would say that if Congress passes something that people don't like, voters would hold those members of Congress accountable, and they might lose their jobs in the next election. Well, the safer the seat is, in other words, if you redraw the lines so that most of your voters are likely to vote for the same party, and you can predict that vote, it makes it easier for elected officials to pass legislation that doesn't help everybody in their district, or that people don't like, if they feel fairly confident that they won't lose their jobs for doing so. So it is a big deal in the sense that in this landscape of trying to get more predictable and essentially making sure that the existing power structure remains the same or deepens, that does potentially mean that some of the issues that we care about, where we have seen big cuts or, you know, priorities that aren't necessarily things that benefit people with disabilities or older adults, that maybe a bigger majority of some of those same people would continue on that path and continue to do similar policies. So now that Texas has redrawn its maps, the pressure has turned to Indiana. And this article does show that there is a lot of political pressure on now state lawmakers to redraw those maps under threat of, well, maybe you won't lose your jobs from the voters, but if I primary a candidate and fund that other candidate and try and get another person to win your seat, that is, again, a leverage point that can be convincing for lawmakers to do the thing that is desired in order to not be targeted and lose their jobs. And just as an illustration, you know, these statements were made this week about mail-in voting and, you know, different kinds of, you know, we should reform our elections, etc. And local decision makers, some of them have already kind of changed what they do locally. Partly, it looks like in response to some of those comments already. So again, the correlation of we should end the use of mail order ballots and changes at the local level, they are happening at the same time in a way that would mean if there were less mail-in ballot opportunity in this particular local jurisdiction, there's also now far fewer in-person polling places. So if you reduce the amount of the amount of polling places, that means people have to travel farther, maybe wait longer, and be able to get there at all to participate in their voting. And if you also expect that mail-in voting might not be as much of a option for people, you really kind of have funneled voters into having to participate in one kind of process at a lot fewer spots. Also, with regard to voting, the administration has an existing tool that it's kind of tweaked and has asked for states to give them their voter registration rolls. The intention of this this tool is to look for non-citizens registered to vote. This is not the original intent of the SAVE tool. It was originally a tool that was intended to help people verify immigration status for people who might be seeking government benefits. And that is typically done because there are lots of undocumented or even immigrants with various legal statuses who are not eligible for a variety of federal benefit programs. And, so this is an existing tool, but it's now being expanded and applied and wants additional data from states to do these things. So there are a lot of advocates who are concerned that if states do give their voter rolls, that the federal government would get a lot more information on Americans who have been registered to vote, and it's unclear what they would do with that information. Very few undocumented immigrants have ever been caught voting. Like, this is not a huge issue. There's already lots of checks in place to make sure that people who are not citizens are not included on the voting rules. So the vast majority, almost everybody who is on a voter roll probably doesn't fit that that profile of an undocumented immigrant. So what would happen with that information? And nobody knows. There's also some concern about, well, one, use potentially of all of that information that states would give potentially to run through the system would be, you could maybe make some assumptions about how people voted, or who, or target people, or use that information in a way that might lead to more restrictions on voting. We did talk about an executive order 2 or 3 weeks ago that was, I think the title of it was focused on crime, but really the meat of the order was about targeting homeless people and increasing the use of involuntary commitment on people who are homeless, with some assumptions that homeless people are also people with mental health conditions or substance abuse issues. And there are certainly homeless people who do have those issues, but the order was written in a way where it very much made a one-to-one connection that people with mental health issues needed to be involuntary committed. And in fact, it also expanded the idea of who could be involuntary committed, not only to people who are a danger to themselves or other, but just unable to care for themselves. So the American Bar Association wrote a response to that executive order, and I'm including it here because, attorneys tend to be fairly careful people, and they don't get too riled up about a lot of things. So when you have the American Bar Association, especially the folks who are really concerned about disability issues, saying, hey, wait a minute, this has a lot of red flags for us, I think it's worth noting. Again, CMS, there's a lot of themes here about data use here. CMS has announced this week that it will be giving states monthly reports with lists of people whose citizenship or immigration status could not be confirmed through federal databases. Apparently, it sent its first list on Tuesday. We don't know if Wisconsin has really received a list or how many people are on it. It's a little bit odd, given that only citizens and certain lawfully present immigrants can be in Medicaid or CHIP. So it's not clear like how these lists are generated, and it's also not clear if there might be mistakes. You know, sometimes people who are immigrants have a change in status. And the thing is, when you're marrying a whole bunch of data sources together, if there's a mistake in one source, that could create a mistake for the whole record. So it's really unclear how this information is being generated from what sources. It's also unclear what states are supposed to do. And it's also clear that there may be many, many citizens and lawfully present immigrants who live in families with mixed immigration status. And that could include undocumented immigrants. Again, yet another data set where it is unclear where it's coming from, how that data is being identified, and whether it is, a mistake or not. Moving on to, we're now starting to be in the phase where we are implementing the changes that were included in the July 4th reconciliation bill. 2 weeks ago, late last week, there was a conference, and it's the MESC conference. It happened to be held in Milwaukee, where CMS officials told states that they would not be granting waivers to give states more time to implement Medicaid Prove Your Working requirements. That's significant because the bill had included three things. It said states could implement work requirements earlier than January 1st, 2027, if they wanted. That's option one. It said states had to implement work requirements by January 1st, 2027. That's two. Unless CMS granted states a waiver, and then they could get a extension to implement those Prove Your Working or exempt requirements until January 1st, 2028. And CMS had the discretion to offer a waiver or not, or revoke at any time, and states had to, do certain things to prove that they were in fact making progress towards work requirements. There was a lot of language in the bill about those potential waivers to allow states more time, up to a year of time, additionally to make a system that would do all of the things that are required under the bill to operate a work requirement program. So CMS said, we're not doing waivers. There will be few, if any, waivers that are granted. And that means that the deadline of January 1st, 2027 that's in the bill becomes the default deadline for all states to implement Prove Your Working or exempt requirements. The other thing that's in the bill is that CMS doesn't have to give states any guidance about what they need to do to implement those requirements until next year, June of 2026. It appears at this conference that CMS seemed to recognize that they have to do some guidance earlier than that deadline of next June. But they also didn't say when they would give that guidance. So, that could be May of 2026, which wouldn't be that much more helpful. So anyway, now we know that all of that language that that was in the bill that looked like they were potentially not going to have anybody implement things until 2028 is placeholder text, essentially. In the past, when you've seen that in legislative language, there has been an assumption, and usually it has been true, that the federal agency will always grant the waiver to all the states and that they will automatically get that extra time. Not true now. And the first state, Iowa, is in fact going to be implementing their work requirements early as of the 1st of January 2026. So they are using that clause in the reconciliation bill to do to implement earlier than the January 2027 date. Iowa happens to be one of multiple states who may have asked CMS for permission to implement prove you're working or exempt requirements through a waiver, and that was denied. So it is possible that Iowa has done some amount of thought and work on work requirements. They seem to feel fairly confident that whatever they have planned is in alignment with what they think CMS is going to require. So that could mean that about 100,000 people in Iowa who don't have to do those things now will have to. And already advocates are worried that there will be glitches that will happen in a untried system in relatively short amount of time. I mean, we're talking about 3 months until the end of the year, and it will mean that people may lose coverage. There's also some concern that for a lot of the rural hospitals, those people who lose coverage may in fact disproportionately impact the operating revenue for some pretty delicate hospitals. Speaking of rural hospitals, again, another provision in the bill was a $50 billion fund specifically for rural health. Now, notice it doesn't say rural hospitals. It says Rural Health Transformation Program. And it's fairly unclear how this is going to work. Our State Department of Health Services did a little webinar and briefing, which was pretty good at explaining what's actually in the bill. So out of that 50 billion, 25 is equally distributed to all states. And CMS, again, has full discretion on where the rest of that money goes. Remember, CMS has just used its discretion to not give states more time to implement prove you're working requirements. So discretion can be used to do all sorts of things. It's possible they could award the full 25 billion to one state. Who knows? The funds that there's a limited number of things that the funds can be used on, and none of it can be used to offset expected losses in Medicaid. The other thing is that this law doesn't define what's rural, and there's no requirement that grants actually go to rural hospitals. So there's no guidance that has been released to states, and states are thinking that the window for applying may be between the beginning and end of September, which isn't that many days. So our state is going to make the application. They are going to ask people for ideas about like how could we use this money to put in that application, and they're going to throw it in, and then it becomes CMS's responsibility to make the decision again by the end of the year, and states can't spend any money until they approve the state's plan. So again, when it comes to implementing what was in the bill, this is an example of something that sounded good and was sold as a solution for rural hospitals. But when you look at the details, how much of that money is actually going to go and is going to make up for the challenges and the cuts that rural hospitals face, it's very unclear. It could be a very little amount. The other big thing, Medicaid advocates wanted to talk to the department about Medicaid, but they really are worried about SNAP. So again, when it comes to impacts from the July reconciliation bill, really the first things that may hit us are changes to the SNAP prove you're working or exempt requirement. Now, SNAP already has work requirements in it, but there have been the bill made a number of changes that mean many more people will have to comply with those requirements. First of all is an age change. So now people over age 18 and all the way up to 65 will have to prove they're either working or exempt. And this is important for disability advocates to notice. The law changed to remove some existing exemptions that had been part of, these were groups of people who did not have to do the work requirements. And the three groups were veterans, homeless people, and people aging out of the foster care system. So when you think about how do we administer work requirements, even when we have an existing system and staff that is used to checking a certain population of people, now you're adding a lot more people who have to do those things and get it verified in order to keep their food assistance. Not only more people because of age, but people that you used to be able to say you're exempt now are part of the population of folks that has to prove they are working enough or that they are exempt. The other change is that it's becoming very clear, and I don't think this is a surprise, that counties will not be able to waive work requirements for residents because there aren't enough job openings in the county. Those were called geographical waivers, and the bill changed kind of the threshold of what you needed to qualify for those waivers. So again, that's another way. And there were several counties in Wisconsin that had a high enough unemployment rate to qualify, that the residents within those counties didn't have to go through the work requirements process. Well, now you need a 10% or higher unemployment rate, which virtually means no one will qualify unless the economy really crashes. And that means that people who live in those counties that were formerly able to be exempt for those requirements because of the geographical waiver, again, that's more people who now have to do something different. And if you have a lot more people that have to go through this process, it does mean you need more workers and more staff time and more money to be able to process all of that paperwork. The other pieces of SNAP that are hitting pretty soon, especially with Approve Your Working requirements, there was no implementation date in the bill. And I think that's what our Department of Health Services is really worried about, because when there's no implementation date, it means the date the bill was signed becomes the date on which you're supposed to be doing all the things. Well, that's July 4th, which is 2 months in the past, 6 weeks in the past, 2 months, whatever. So when DHS says they're worried about the SNAP requirements, it's because some of those requirements are already supposed to be in place, even though the USDA hasn't issued any guidance to states. And that means that whenever they actually are formally told, okay, you have to be doing these things, those increased costs, because you have more people who are going through this process, start to hit as early as this fall, like anytime. And the other piece that's happening is the reconciliation bill also reduces the amount of money that the federal government gives states to run the program significantly, starting 3 months from now in 2026. Right now, they pay for about 75% of the cost of running the program. Well, in 2026, it'll go to 50%, and in 2027, it goes down to 25%. So you have a huge decrease in the amount of federal support to run the program in a very short amount of time, in the same time period where you're also having a lot more work have to happen because the requirements have become applicable to more people. And that may mean that there is a gap. You have costs that you didn't have before and increased costs because you have to do more things for more people. That has all of the ingredients for a budget hole, a state budget hole. So it makes it more likely that at some point our current state legislature will have to decide whether or not to give more money to help keep operating SNAP. And again, state legislators don't have a lot of options. If they have a state budget hole, they could either raise more revenue to fund the increased spending. They make cuts to other parts of the state budget, or there's just not enough money to run SNAP. And either, counties do the best they can, and there are a lot of eligible people who get who do not get food benefits at all or get them delayed. It becomes a less than effective program. That matters because the more errors you have, the other thing the reconciliation bill did is it requires states to match based on their error rate. So we have a low error rate now, and we really want to make sure that the way we are administering SNAP continues to result in a low error rate, because otherwise that's a really big cost that the state would have to pay that it doesn't have to pay now. The USDA is also discontinuing some waivers it's given to states that have been renewed over the last pretty routinely over the last 4 years. So these are called geographical waivers again. The particular waivers we're focused on here made it easier for people in SNAP to conform with the requirements. So they were granted during the COVID pandemic, but they've been decent ideas. They've made it easier for people to, say, use the phone to call in and verify their work hours instead of having to stop in person. It's made it easier to administer the program. Well, USDA is revoking all of those COVID era waivers under the idea that the pandemic is over, which means that people are going to have to go back to more intensive, time intensive and transportation intensive ways to report their work hours. If you're no longer allowed to use the phone because the waiver was what enabled states to do that, that means you're going back to face-to-face. There's also been some discussion that all the geographic waivers, and I talked about those, the waivers from work requirements for specific areas that don't have enough employment opportunities. The message is being given to states that you should expect that none of those will continue. So that, again, that's a lot more people impacted, and it makes it harder for folks to report their hours. Over the last couple of months, there's a real theme on data gathering. Again, the SNAP data gathering on SNAP recipients is starting as well. This is relatively recent. I feel a little bad we missed this, but there's been some coverage of it. USDA has told states to provide data for SNAP participants by July 30th. And for a long period of time for the last 5 years. So again, this appears to be an attempt to use that application information to check against immigrants and citizenship status, as well as some other things that have very little to do with immigration status. So again, it is unclear what this information states are being asked to provide is in fact going to be used for, and what ability they have to protect the privacy of people who are applying for a program because they need food assistance. Wisconsin has again joined yet another lawsuit with 21 other states this time that is challenging USDA's demand for state SNAP data. And we'll see where the court comes out on that. There's also been increasing rumors that there are hundreds of millions of dollars worth of in-progress federal grants that are part of IDEA Part D funding that will be cut in the coming weeks. Some people are speculating that may be part of a rumored rescissions bill. These are not the formula funding that states get to directly help pay for special education services. These are competitive grants that fund all sorts of other things that are important to supporting students with disabilities, special education training, for example, data collection, research, all those things. And it appears at least as it's being reported, that these grants have been identified by AI because for termination, because they have language in them that the program is recognizing as associated with DEI. Wrapping up, there have been a few more articles that are coming out and a few more opinion pieces. This was a particularly good article that I've seen circulated quite widely. But again, it emphasizes something that we've been talking about over the last several months, that really these cuts to Medicaid are going to jeopardize the higher cost optional programs that keep people in their homes and out of institutional settings. Home and community-based services, which we know of in Wisconsin as Family Care, IRIS, and CLTS. So this article is about two sisters who are aging with disabilities and who have been successfully living in their own apartment for many years and decades, and how they're thinking, how they have been managing and thinking about what these cuts could mean to the caregivers that they are paying and their ability to continue to stay in their own homes. Interestingly, while it's not new news for us that home and community-based services are a big part of what Medicaid spends their money on, and it's a prime target where states are going to look if they have to make cuts, it is interesting. There's a nice tidbit about researchers specifically looking at cuts to home and community-based services as being the driving force for 3 million people, especially if they're age 50 or older, who are living in their homes now, having to live in institutional settings. This is not necessarily disability related, but I put it in here because we did talk about the rescissions bill that passed July 18th, and that did not have disability related cuts, but it may have disability related impacts. There was a specific rescission that removed funding for the Corporation for Public Broadcasting, which is public television and public radio. And it's an example of, you can take away money without fully recognizing the impact and consequences of that removed funding. In this case, for many parts of the country, public radio and television is the way that disaster warning transmission happens, which especially for people with disabilities and rural areas, many people with disabilities live in rural areas, is pretty important. So I included it in here because it does show folks that, you can make a policy change and then learn about the impacts locally in a very, very tangible way once it's too late. And it can have, unexpected consequences, especially for people with disabilities, who may not be folks that have, internet connection or the smartphones or, other options other than these kind of stable, low-tech things that we assume everybody has access to. Not anymore if the funding isn't there. Okay, I am going to stop sharing. Sally, are there any questions that haven't been answered?
No, everything has been answered. So I think we're good to go today.